Hi, I'm Dr. Larry Werlin. I am a reproductive endocrinologist working at HRC in Newport Beach. I originally went to college in Boston at Boston University. Went to medical school at Mount Sinai School of Medicine in New York City, and then did an initial internship in internal medicine at Harbor UCLA Medical Center, and that was followed by residency in OBGYN at Harbor UCLA Medical Center. I was then awarded the third National Fellowship in Reproductive Medicine and did my reproductive endocrine infertility fellowship at the National Institutes of Health. So after finishing fellowship, I was a faculty person in the division of REI at the University of California at Irvine, then became the medical director of the Hoag Fertility Services at Hoag Hospital, and was their medical director for approximately 10 years. Then became the medical director of Coastal Fertility Medical Center, and I am now on the staff of HRC Fertility in Newport Beach. One of the few things in medicine that really makes any sense are hormones. You have too much of a hormone, you respond in a certain way. You have too little of a hormone, you respond in a certain way. You can manipulate these hormones to get a specific reaction. So it was one of the few things that really made sense in medicine. And in reality, I had always wanted to be a doctor. And I'm one of the few people who actually gets to live the dream that they had. Now, when you ask me what other things do I do other than medicine, I have to confess that medicine really is my life. I love it. I love what I do. I love dealing with the patients. I love just being a part of thinking of what goes on and how to adjust a protocol or how to adjust something for patient care. So as part of my being in reproductive medicine, I have been very fortunate. I'm sure that many of you have heard of the medication Lupron or leuprolide acetate. I actually did the first animal studies on that drug with respect to the treatment of endometriosis when I was a fellow at NIH. We did the first randomized prospective study looking at pre-implantation genetic testing for aneuploidy in women who have advanced maternal age, and published that data back in 2002. I was the principal investigator of that study. There were actually 3 arms to the study. And at the time, I was the principal investigator, and the group was called the Genesis Network for Reproductive Health. And it was very exciting, and a very exciting time for us. The most exciting part for me is to sit down with a new patient, talk with them, listen to their history, and hopefully design a plan that will help them be successful. When they are successful, it's the most incredible event that you can imagine. Every time that I get to call a patient and tell her that she is pregnant, it's like I'm doing it for the first time. It's the most incredible and exciting feeling that one can have. It's just a very exciting thing. And for me, it's a reaffirmation every time it happens. I'm Dr. Larry Werlin from HRC Fertility in Newport Beach, and it would be my honor to be able to help you to achieve your ultimate goal and have a family.